Another question from you, caller. Hi, what's your question, please?
Yeah, I have a question on, I know that my risk factors are very high just because my father had his first heart attack when he was 40 years old and passed away at 55. And being a woman, I do have high cholesterol that is controlled by a statin. And I live a pretty healthy lifestyle, but I'm still at very high risk. So where should I get testing done at, or is there, special for women?
Sure. Dr. Manhar?
Yeah, there is special testing available. First of all, do get that high sensitivity C-reactive protein. The next time you see your healthcare provider, it gives another means to assess risk. But certainly, whether it's at Heart and Wellness Institute or many other locations, I'm sure Dr. Miller's office does as well, carotid ultrasound is a good place to start to look at that intimal medial thickness. It can help predict your overall risk for cardiovascular events. Second thing is a treadmill test. A treadmill test can give you a great overall prognosis. There's such a thing as a Duke treadmill score that was meant to give you your overall prognosis for heart attack and stroke risk. And then finally, there is something called coronary CT, which not only is the calcium scoring, but can actually also look at the coronary vessels, particularly moderate to larger size vessels, and see if there are plaques and significant blockages there.
Obviously, we're going to spend more time on prevention after our next segment. Dr. Miller, let's talk about obesity. Why is the correlation between obesity and heart disease so strong?
That's another great question. Obesity in general correlates really well with coronary heart disease, but they really haven't decided, is it obesity per se, or is it the fact that obesity is also related with the other risk factors, quite often hypertension and diabetes or glucose intolerance. And then there's the whole school of thought about what type of obesity. Is it abdominal, around the abdomen and the waist?
Which was my follow-up. Why is that the bigger risk?
And a risk factor is waist circumference in men and women. That's very predictive too. So again, there may be something unique just to having extra adipose tissue in your body, or it could also be the correlation with all the other associated risk factors.
Any follow-up on that?
Yeah, part of the truncal obesity, or that fat collection around the waist that some of us tend to get, can be associated with infiltration, not only in a layer right below the skin, but also in the organs as well. And that has been associated whether with immune diseases such as diabetes, with poor metabolism, and with abnormal cholesterol.
Nice. We have a question from you, caller. Hi, what's your question, please?
Yes, I'm at risk. Well, my family has heart disease in it, and I have high cholesterol, high triglycerides. At one time, my triglycerides were 1,200. I've cut them in half. I try to walk at least 45 minutes a day. I am a little overweight. I've lost 50 pounds, but I can't take the cholesterol medicine they put me on. They've tried me on so many different cholesterol medicines, and my body just hurt. It feels like my muscles are being torn apart. Is there anything else I can do to help myself?
Dr. Delap?
Yeah, there's a vitamin called niacin, which many times we do use for people who have elevated triglycerides. And I do want to congratulate the caller. She's really done a great job cutting the triglycerides in half. Because at that high level, not only is she at risk for heart disease, but also pancreatitis and other types of problems. So I think the next step for her would probably be maybe try niacin if she's not on that already.
What is your advice for the postmenopausal female as far as, I don't want to get into the HRT debate, but as far as minimizing her risk factor as much as possible? What do you think?
The number of years that you are away from having your natural hormones, menopause that is, the higher the risk for heart disease is. It correlates very well. So things that you really want to watch out for are those normal screens that you would do anyway, as you were suggesting, for 20 years old or older, should be done particularly around the time of menopause. When we lose those hormones, typically our blood pressure goes up. All the cholesterol goes in the wrong direction. And many times our metabolism changes, such as we gain fat around our waist.
Okay. We have time for one more call before we go back to the show. Caller, what's your question, please?
Oh, hi. I had a couple of questions. I think they almost answered the one they had talked about, the reactive protein number. Was that the high sensitive reactive protein?
That is
Yes.
correct. High sensitivity C-reactive protein has been the biomarker that has been associated with increased risk for heart attack and stroke.
What's your follow-up question, please, good man? Do you have a follow-up question?
Yeah, it had to do with homocysteine and what the recommendations as far as niacin and red rice yeast pills.
Homocysteine is controversial, and the reason why it is because there have been plenty of studies that shown elevated homocysteine is associated with increased risk for cardiovascular disease. However, the prior recommendation had been to treat it with folic acid. There have been subsequently a few studies that have shown that the high levels of folic acid, not the micrograms that you typically see in your multivitamin, but 2 to 4 grams, so much, much higher, hundreds of times higher,